Hi, everyone. Welcome to this Cardiology Professional Community Town Hall meeting, which is scheduled for today for about 1 hour. We are going to go through some information about the professional community, the cardiology members, and this is today's agenda. We are going to present the current and the incoming professional community leader group, the members making up the group, some statistics about the membership in the professional communities generally, not only in the cardiology, but in the ISHLT. Highlights for the community to know about the Boston coming meeting in April, the yearly Congress. We are going to look at the symposia and workshops for the pre-meeting day and some kind of activities which we are going to have for our professional communities and for the IDN groups during the meeting. And then some words about the planning of the coming Congress in 2026. What can the members of the community actually, in what way they can participate and in what can they submit symposia proposals and abstracts for the meeting and how they can get involved. So we are going to finish with some discussions and questions, and I am more than happy to hear you. So you are very welcome to speak loud, or you can put your questions in the chat. Whenever during the meeting. This is the representative group for the professional community in cardiology, and the chair of the group is Dr. Lynn Panos, who unfortunately couldn't make it today. Lynn is a medical doctor at the Vanderbilt University School of Medicine in Nashville, and she is the representative to the Acute Heart Failure and Transplant Interdisciplinary Network Steering Committee. Then there is Brian Houston, who maybe will join us a bit later. He is the representative to the Mechanical Circulatory Support Interdisciplinary Network, and he is a medical doctor at the Medical University of South Carolina, as well as Ryan, who unfortunately can't be with us either. And he is the representative to the Leadership Advisory Forum. Then there is Anju. She is a medical doctor at the University of Texas, McGovern Medical School in Houston. And she is the representative for the professional community in cardiology to the early career and training committee. There is myself, and I am the representative to the Interdisciplinary Network for Pulmonary Vascular Disease, the PAH and CTEPH group. And I am the incoming chair for this group, replacing Dr. Mark Simon, who has been serving as a chair for the group previously. And then we have Juan Ortega Legaspi, who is with us today. So Juan, you can say some words about yourself.
Yes, of course. Thank you, Clara, and thank you, everyone. Well, it's an honor to be here and I'm representing the ISSLT in Espanol side of things. We're trying, working hard to. There's a huge underrepresentation of the ISHLT in the Spanish-speaking world, particularly in Latin America. So we're working hard to get more folks involved and trying to grow advanced therapies for heart and lung in that underrepresented area in our community.
Thank you, Juan. And you are quite new to the group, but you have been a member of the ISHLT previously some years, right?
Right. Yes.
Yes. And I myself have become a member in 2022, so I haven't been a member very long time, but I think I learned a lot during these years, and I was part of the planning committee for the ISHLT meeting in Boston, not in Boston, but the previous year in Prague. And I think that it's great to be involved because you grow in this role by meeting very experienced and very nice people with different experience and kind of interact and be able to have brainstorming, putting together symposias and proposals and so on. So there are endless opportunities by getting involved, so you can be part of these working groups and get to grow in your professional role. So I am very happy for being here. I am going to, as I said, replace Lynn today because she was supposed to be chairing this meeting, but unfortunately she is not here. So I am just showing some numbers for the memberships in the 10 professional communities which are included in the ISHLT. And as you see here, the largest community is the PC Cardiology, is us, with 29% of the members, and we are followed by the cardiothoracic surgery group with 25%, and then is the pulmonology group 15%. The other communities have somewhat lower representation percentages, sorry. So when it comes to the demographics of the groups, we have 70% of the members are physicians and 18% non-physicians. Then we have some trainees, 10%, not that very many. That group is encouraged to grow. Of course, it would be very nice for the coming generation to get involved. And then we have some 1% of the members are retired or emeritus. When it comes to the distribution, the regional distribution, the geographic distribution, so North America is on the first place, of course, with 73% of the members. But there is quite large representation from Europe as well in relation to the rest of the continent. Because as you see here, and as Juan just said, there is much less representatives from South America and from Africa, Oceania, Asia, and Middle East. So we would like to see more people involved from these parts of the world, and we are actually encouraging everyone who is a member in the ISHLT to involve their colleagues and get together to increase the numbers and to make the community bigger. So when talking about the IDNs, there are 4 IDNs in the ISHLT. IDN is the Interdisciplinary Network, is the abbreviation for that. And the biggest one, more than half of the members identify themselves as members in the Advanced Heart Failure and Transplantation IDN, and this is followed by the Advanced Lung Failure and Transplantation, 28%. Then we have the Mechanical Circulatory Support Group with 13%, and the Pulmonary Vascular Disease Group, which is the group which I belong to, is 3%. It's quite small, this group. And another a group made up by other, so 3%. Some words about the coming meetings in relation to the Congress in Boston. We are going to have some professional community days for getting together. They are scheduled at 6 to 7 p.m. And some of the communities meet on Monday, and cardiology is scheduled on Monday. The others, half of them are meeting on Tuesday, as you see here. So Monday on 28th of April, 6 p.m., it would be very, very nice to be able to join us and to be there for quite informal discussions, brainstormings, getting to know each other and connect and try to come up with ideas for the coming meetings, the Congress, the symposia, which are going to be proposed later for the next meeting. So I'm not sure about the details for the place, but there will these details will be announced as the meeting is approaching. There is also an IDN breakfast at 7 o'clock a.m. on Monday, respectively Tuesday, for the two of the IDN groups, the mechanical circulatory support and the PVD, is on Monday, and for the acute heart failure and acute lung failure PVDs is on Tuesday. So it would be very nice to meet you on either of these, either on the tentative meeting on the in the evening on Monday or at the breakfast that morning. When it comes to the conference program, I am sure everyone has already had a glance at the program, which has been posted on the website, where you can see by day and by topics the programs, both the symposia and the abstracts. And the day before the Congress, we have the pre-conference workshops, and this is a very nice program with 4 different possibilities. So you can choose between the ISHLT ICA conference on chronic thromboembolic pulmonary hypertension, which is on Saturday with a very good program. And then we have the Academy for the Cardiogenic Shock Academy on the same day, or you can go for the lung, but I suppose that many of you, being cardiologists, will choose one of the first or second one, or maybe not that much on the lung failure and transplantation core academy, but you can choose that one, of course, as well. And then there is a workshop on diversity, equity, inclusion, and accessibility, which will be on the same day. And the details about the program, the times and everything are put up on the ISHLT website. So you can access those and see more about the meetings. We have yearly a webinar for each professional community and even for the IDNs. The professional community webinar for the cardiology PC was in October on 4th this year, and it was about extrinsic outflow graft obstruction in patients with mechanical circulatory support. It was quite well attended. We were happy with the numbers. I mean, the people who registered for the meeting, it was 126. It was on the 2nd place after the cardiothoracic surgery community. Not very many who were able to attend live. It was 48, but 196 views on the ISHLT YouTube channel. So you can go and watch it at a later time, of course, because it's recorded. And for these meetings, we also encourage all the members to submit proposals for putting up an interesting and exciting program. As a member, you can participate in these meetings where you can just send them by email to the PDN group your proposals or ideas about the webinar topic. The date for the next coming webinar for the cardiology PC is not decided, but it will be in the autumn, in the fall of 2025. So you had some time to think about topics and to come up with proposals. And now some words about what more as a cardiology member, as a member in the PC cardiology. There are several opportunities. Is of course possible to submit these proposals for symposia, which I talked about, and I will show some more details about how the process is going to happen, or how is actually organized, the logistics about that. You can submit an abstract to the meeting, and you can be an abstract or symposium reviewer. And it's about 40 abstracts which you are going to review and you have about 2 weeks for allocated time to do this. So I think this is a very nice way of starting. You can go through the interesting abstracts and topics, and you can select the abstracts by rating them. Of course, there are several reviewers looking at the same abstract, so there will be a composite score in the end, which will rank the abstracts, and they will be then selected for the presentation at the Congress. You can engage in discussions and proposals about coming standard and guideline documents in the working groups which are dealing with these aspects, and you can of course submit ideas for the webinars for the idea, and as I just said on the previous slide, I showed those details. So now I was thinking to show you how maybe there are some of you who have not done this before, so I think that would be nice to have some insight in how you do, how when you want to submit some proposal for the coming Congress. The details for this are just posted on the website shortly after the meeting, when the Congress in Boston will be finished. So the details for the next coming Congress will be put up, how you can submit proposals. You have to be a member of ISHLT to be able to submit, and you can actually put together your proposal quite early, whenever you get the time and the ideas, and then it's good to have this like some weeks before the deadline for the submission, which is in the end of June. And it's good to have it ready for a discussion, because you can, and you are encouraged, actually we encourage the members to discuss these proposals with the professional communities and the IDN networks for getting feedback and for getting help to refine the content and to make it interesting and appealing for the audience, of course, and to increase the chances for the symposium to get accepted. So you can, of course, yeah, submit it, but usually the committee, the program planning committee, will maybe not take your proposal as it is, but it will go after a policy slice and dice, which means that several symposia proposals will be, of course, reviewed, and then parts of it, every symposia proposal which is regarded as interesting and good for putting up on the program, will maybe be combined with parts of other symposia proposals. So in order to get the best out of this. So you should not be surprised if you won't get the whole proposal accepted, but parts of it. Usually when you have been a symposia proposal submitter, you can also get the chance to be a invited moderator or speaker for the symposia, for that specific one or for other symposia. So you should not be shy. You should dare to put your name on the program, and as I said, your chances to get selected as a speaker or a moderator will increase by submitting and being active part in this process, which is actually very, very nice, because you get to talk with the colleagues, the volunteers, which will go through these proposals on the meetings. We have some meetings to discuss symposia proposals, which are open meetings, open house, so everyone can just connect and discuss through the proposals. Then after the proposals are submitted in the end of June, generally there will be throughout August and September, the program planning committee will go through and refine the program, and generally the preliminary program is ready in the early December, and then you can get to see if your proposal has been accepted. So and you get of course a mail about that. And you get very happy when you get to be part of it, I think. So it's very exciting. So this is how it looks, the proposal blanket, which you should, it's a digital form, of course. You fill in this online, and you can put up your proposal in this form, but then you have to copy and paste it in the submission, on the submission site. And you can choose the prime core therapy for your symposium, and also add also add a second core therapy. And the more complex or the more interdisciplinary it gets, the better it is, because you will get probably more people in the audience if you involve and you have a topic which covers different aspects or interdisciplinary aspects of, for example, a syndrome or some kind of treatment guidelines which are covering lungs and heart, for example, or So you have a short description of your session and then what educational needs it fulfills. And this is just an example for one of the proposals I was part of. And then you have the possibility to select if it's kind of designed for early career with a focus for the early career or not. And if you got your IDN involved in the selection or the refining of the program, and that will give you some merit points, because if you have done that, then it's probably, I mean, it gets better by having these discussions and reviewing the content together with your IDN. So this is good to do before. Then you can choose between different formats for the symposia. This is a classic one, for example, but there are several different Pechakucha and so on, case-based and so. So this is a standard format. For example, in this case, you have 4 or 5, you have place for 4 or 5 talks and divided by 10 or 15 minutes. Is 60 minutes for the whole symposium for the talks, and is 15 minutes for the Q&A, either after each session or in the end of the symposium. You have to I mean, you have to, it's not usually, but you have to suggest both first name for a moderator, for example, and an alternative moderator in the case the person you suggested is not available. So it's easier for the planning committee to choose an alternative. And it's the same for the speakers. So this is how it looks. I think it got some, insight in how we do it. So I don't have so much more to add to this, but I hope that there will be interest and for many of the members to involve with the next Congress program. And guess just keep alert and try to get to work with these symposia proposals in time, so you can refine them together with the IDN or the professional community group which you belong to. So I think that with this, I would like to hear if you have any questions or comments or ideas or whatever. So is there anyone who wants to share anything?
I just wanted to mention and I think this information was already shared, but just in case, that we received a record number of abstract submissions for the meeting up in Boston, over 2,000. And we're expecting 4,000 people there. It's going to be the biggest ISHLT meeting that we've ever had, with the most content on the program. So
it sounds very good.
There.
Yes.
Thank you, Clara, for your terrific leadership and for stepping in.
Thank you a lot.
Really
Thank you for being part of it. I think it's really, really nice and very, I mean, it gets you in some places where you where you haven't been before, like getting to see people with enormous experience, and you can connect in a very easy way. And then even if it's not about the research, but it's about the clinical interaction, you get connected with people whom you can approach then later if you need help and ask about complicated cases or whatever. It's much easier to just write a mail to someone whom you met and discussed with. So it's also that aspect is not only the the research aspects and yeah, so it's lots of interesting things you can learn from this. Yes.
Yeah, I agree. I mean, the opportunities to connect, to interact with colleagues that you would never otherwise meet or be connected to are great. And also getting involved with the society. I think that the more we can try to get people engaged, to try to submit more symposia, just getting more ideas. It's always, that's why sometimes you get all these, oftentimes when I've been in the meeting over the last few years, you see all these symposia that you're like, oh my God, how did they think about that? And it's really cool, right? So to be able to really interact and come up with things outside of the box is very nice, and not just flashy names, because lately we have all these flashy titles for all the symposia, but the actual content is actually very much outside of the box, which is really cool and makes it a lot of fun to be there. So I'm very much looking forward to it, and hopefully we'll get more great ideas from all the community.
Fantastic.
Yes. We do hope so, because it's, as I said, is good for growing in your professional role, and you get all these insights. Beside, you learn a lot from the different organizations, how they work and interact, and not at least now I have full insight in the complicated structure of the ISHLT, but I think that is very nice to get to know how the things are working, and so it's complex, and it's very in some way you get these interfaces which you are not aware of, and by working through the different IDNs, you and the professional communities get kind of interconnected, intertwined. So it's nice to work together in these networks, say. Well, we have Marco with us today, and Marco, you would maybe want to say some words about you. You are an invited member. Hopefully, you are going to submit many proposals for the coming meeting.
Well, nice to hear from you, and I'll be happy to take part in it. This year I can't come to Boston, but right after the meeting I'll be happy to send proposals for the next meeting, and I've been in maybe 3 ISHLT meetings, 3 or 4 before, and enjoyed them.
Yeah.
Quick comment that the titles are flashy and fun, but sometimes the titles are so long, and if you look in a screen or in the app, it has been at times a bit difficult to find out quickly what's the session actually about if you can't read the whole title. So they are fun, but they haven't been really that informative.
I agree. Some of the titles have been pushed a little too much.
That's good feedback. Thank you.
Maybe we have to have a kind of a limit for the number of words which are allowed in a title.
Yeah, I mean, I like it that some are funny, some are flash and all that, but yes, it's true that sometimes we take it a little to the extreme.
Yeah.
Yes. Yes, but and I suppose, Marco, that if you get involved and so on, you are also dealing with both acute heart failure transplantation and pulmonary arterial hypertension. So you will be involved probably in this symposia proposals for both communities and for the community and IDN PVD. Yes. Do we have any other questions, or should we wrap around the meeting, you think?
I think we're good. I really appreciate everybody joining.
Yeah,
Thank
it's
you a
very
lot.
good. So look forward to staying in touch and on new meetings, and hopefully get to see you guys in Boston.
Yes.
Yes, I will be there, so I hope to see you in person. All of you will be there.